Welcome to part 2. We're going to do muscles of the lower body now. We'll start with the abdominal muscles, not really lower body yet. We did the back and the first part, so we'll do the abdominals now. And we have 4 abdominal muscles. Our first one is called rectus abdominis. Now, whenever you hear rectus, you have to think the center. Rectus is referring to the center, so this is the center of the abdomen in this case. So these are your six-pack muscles. And whenever you get the six-pack, what you're seeing are people's rectus abdominis muscles becoming very defined. So on our little model here, you have these little muscles, and what it is it has a little connective tissue that connects each little segment to each other, and that's why it makes that those little bunches of muscle that are separate from each other instead of being one long muscle. Let me get the slide up. Well, come on, there we go. So these are the rectus abdominis muscles right here. So these are attaching to the ribs, the anterior ribs, and then coming all the way down to the pubis down at the bottom here. So it's going to allow you to flex your spine. Flex your spine, or bring your ribs closer to your pelvis. So this is your sit-up muscle. It allows you to do sit-ups. Now you have 2 obliques. You have the external and internal obliques. Now oblique refers to a diagonal direction of fibers here. So it means it's diagonal. And when of course you have external and internal. So when you look here on the lateral parts of your abdomen here are external obliques, because they're most external, more superficial. And here you see cut through the external obliques, and you can see the internal obliques have fibers that go the opposite direction. So these muscles not only help flex, but they also help rotate. So these muscles help flex and rotate. So these are going to attach to your ribs and also end up hooking into your pubis bone, but they are going to flex as well as rotate. Okay, so this allows you to rotate your trunk really nicely. And then finally you have your transversus abdominis, which is deep to your internal oblique, and it just literally transverses across. I have some slides showing this. So here's your external and internal obliques. You can see those internal obliques will actually give you some lateral flexion as well. And then here's transversus abdominis. And mostly where you use this is a lot of times with breathing you're using this. When you blow, when you want to constrict the abdomen, you do this. Is one of the main things you do here, but it's going to also allow some rotation. So it'll allow you to pull around a little bit. All right. These next muscles here are a little, are kind of weird. They're the pelvic floor muscles, not ones you normally think about too much. But these are muscles involved in basically working the penis, the vagina, and the anus, things like that. So levator ani tells you, the name tells you what it does. It allows you to elevate the anus. This is what prevents, oh my gosh, what do you call it? Where the rectum's trying to come down. Your levator ani is not holding your rectum up in prolapse. Not your anal prolapse here, or rectal prolapse, is when a levator ani is weak. So I believe this one's not, and it's this muscle here, and it forms sort of a bowl to contain your intestines in there, contain all the things that are all inside of your abdomen there. So that's levator ani. It's not showing there. Let's see, coccygeus are Let's see, this one's very similar. I think it's a different picture though. Same muscles, but on the female. So coccygeus is so you can see levator ani down here, sort of forming this bowl around all your different orifices here for the female in this case, but the same for the male. But your coccygeus sort of is a little bit more posterior and up, but it's basically doing the same job. It just keeps all of your internal organs in your abdomen there. So levator ani coccygeus allows you to keep your, especially digestive organs, in place and out from falling out of your abdomen there. All right. Superficial transversus perineae. Now, superficial transversus perineae, and so the name actually tells you it's very superficial, and it transverses or goes across the perineum. Now, in the male, the perineum is between the anus and the base of the penis there. So it's this spot right in here. So this is just going right across the perineum, and it's basically allows you to kind of contract some of the allows you to contract that perineum. Not sure what other actions that would be there, but and then the female does the exact same thing. Comes straight across the perineum, this again between the vagina and the anus, and so it kind of allows you to move some of these a little bit, contract these muscles a little bit, and give you some control there. I don't have a great action. I'll read whatever it says in the book is great. Bulbospongiosis in the female, this is basically the sphincter muscle around the vagina. So this is what allows you to sort of constrict the vagina. In the male, it has a very similar action, except males don't have a vagina. But so the bulbospongiosis is what is around the shaft of the penis and allows the male to constrict the penis, usually to push urine out. It's also involved in ejaculation as well. Ischiocavernosus is involved in erection of the penis, allows the male to elevate the penis. And I didn't give you that one when we talked about elevation depression. But yes, you can elevate the penis there using the ischiocavernosus there. And the female, of course, doesn't have a penis, but the female does have a clitoris. And so this actually allows the female to move the clitoris a little bit there. So similar functions in both male and female, but just different parts, so it works a little bit differently. The sphincter urethrae is not pictured, but this is just a little sphincter muscle going around the urethra. So it allows you to shut off urine. So whenever you want to stop urinating, you have to use your sphincter urethrae or prevent urinating. Oh gosh, sorry. So the sphincter urethrae again allows you to stop yourself from wetting your pants from urinating when you don't want to. Great. Moving the thigh. Let's move on to that. So our first muscle here is one that you probably may have never even heard of, probably never even thought about before, is your psoas muscle. The psoas is kind of a weird muscle. It's actually in your abdomen, deep in your abdomen. And it attaches to the anterior parts of your lumbar vertebrae. Shown up here. Attaches to your lumbar vertebrae. And so this is going through the abdomen, through your pelvis here, kind of through the inguinal part of your pelvis here. And so the inguinal region is actually, well, there's an inguinal ligament that connects the ASIS down to, is it your pubis? No. I believe it's your ischium, actually. So look at that again. But anyway, it creates a little tunnel in there. So the psoas goes through that little tunnel, and then attaches to your lesser trochanter. That was not on your list, but that's a little spot just on the anterior part of your femur there. Anyway, this is one of the major muscles involved in flexing the hip. So this is flexing the hip, psoas. It has this partner, iliacus, which is going to also flex the hip. And a lot of times people call it the cilia or the iliopsoas because they kind of run together. This is the psoas right here, cut off on our little model. You can see that your angle there. So you have the psoas coming down. This will be attaching to anterior vertebrae, and it comes through. Here's your here's the answer. Here's the inguinal ligament attaching to the pubis there. Yeah. And so yeah, here's the psoas coming underneath that. The iliacus is actually attaching to the inside of that iliac crest there. So there's the iliac crest, and it's attaching to the inside of that. And then it kind of hooks right in with the psoas, and they both attach to that lesser trochanter muscle. We're looking at lesser trochanter landmark. So then again, both of these are flexors of the hip. So whenever you do that thing, a lot of exercise classes where you lay on your back, like supine, and you put your legs out straight, and you lift at 6 inches, 1 foot. I remember we always do 6 inches, 1 foot, 6 inches, 1 foot, both back and forth, or just hold it. And you're like, oh gosh, it hurts, and it's real hard to exercise. But that's all psoas and iliacus exercise there. Gluteus maximus, next muscle here, is of course your butt muscle, labeled number 71 here. These are all from last semester. But so this is your gluteus maximus back here, the butt muscle, and its major jobs are to extend the hip, and it also does some rotation. I want to say it looks like it should be lateral rotation. I believe it's lateral rotation of the hip, so it's going to allow you to sort of point your toe laterally there. And those are its main actions there are extension, just move this, extension, and a little bit of lateral rotation. Its attachments are up here to the sacrum and a little bit to that PSIS, the posterior superior iliac spine of the pelvis there, and then it comes around here and attaches to the lateral part of the femur. Gluteus medius is actually very different. It's way over here on the lateral part of your thigh there. There we go. So there's gluteus medius there, maximus, touching that lateral part of the femur. This is gluteus medius here. It's the most superficial one, and if I move the gluteus maximus out of the way, so you can see gluteus medius a little better there, and then take this off, and there's gluteus minimus underneath. So they're shaped just the same, but it originates lower down on the ilium there. So the gluteus medius originates on the iliac crest, and they both come down and attach to this this band of connective tissue right here. It says dense regular connective tissue. So this is like a big tendon, basically. It's called the iliotibial band, or IT band for short. And so all these muscles are attaching to that, and it attaches way down here to the lateral part of your tibia. Lateral part of your femur and tibia down here. So this is going to allow, this muscle is a very strong abductor of your hip. If you can see my legs. I need to show you, you're going to see my legs for all of this. Let me just move this a little bit. I just have to do. I'll move the table. That'll work. Okay, so this is so this gluteus medius and gluteus minimus are both going to be involved in abduction of the hip. You can imagine if you pull on this IT band, it's going to pull this out like that. Abduction. The piriformis muscle is deep in the glutes here, kind of the posterior lateral side. It is just posterior to gluteus minimus, or sorry, gluteus medius. It's this muscle right here. It comes from the sacrum there, so it originates in the sacrum, and there's iliacus and psoas all by themselves. Let's see. Look at those in a little bit. Not sure why I'm there. Weird order going on here. Gluteus maximus. There's minimus. There's piriformis right there. So it originates on the sacrum here, and then to the greater trochanter. And mostly this muscle is going to externally rotate. So it's going to allow you to point your toe out. My wife Marty is a dancer, and she was trained as a ballerina first when she was young, and then she started ballroom and modern dancing later. But anyway, she always talks about in ballet, you're always pointing out, or pointing that toe out whenever you stop somewhere in the dance somewhere. So she always calls us the ballet muscle. The piriformis is that little turnout. And that's what it does. It's mostly an external rotator, or lateral rotator. I believe, I didn't mention this, but with gluteus medius and minimus, and I believe tensor fascia lata as well, are all medial rotators. We have that. I'm pretty sure those are medial rotators. Quote me on that. Again, mostly those guys are abductors. So piriformis is again mostly external rotators. I believe that's its main deal there. Tensor fascia lata is just anterior to glute medius. So it's this guy right here. And we'll get back to the slide where you can see that. There you go. There's tensor fascia lata. There's glute medius. Tensor fascia lata is just anterior to that. And again, it attaches to that IT band. So very similar to glute medius and minimus. And this will do a little bit of flexion of the hip though. So because it's more anterior, it'll actually help with flexion of that hip. Often this gets really tight and you can't get a good extension of the hip. So you have to stretch that guy out. It's tensor fascia lata, or TFL for short. All right, so now you have the adductor muscles. This can be a little tricky. We'll get back to the beginning of my slides, because that's where we talk about those. Here we go. So I have them in order from medial to lateral attachments. So the pectineus attaches right up against the pubis there. Let me get some of these muscles out of the way. Sorry, I have it wrong, don't I? Yeah, pectineus is attaching most laterally. So pectineus is most lateral over here. I was pointing the right one, but that's the wrong word. So pectineus is just a short muscle, touches in the more lateral part of the pubic bone there. And then this goes and just attaches to the anterior part of your femur. Adductor brevis is the next one over. So it's going to be adductor brevis and longus. So actually brevis is underneath longus, so I have to, might be wrong. Yeah, that's correct. Adductor longus. And the name, of course, tells you all these are adductors. So hard to get off. Let's see if I can do it. I don't know if it's very helpful. You can see these anyway, but anyway, underneath here it comes. There's another little muscle. You try, no way you can see that from there, but there's another muscle right underneath adductor longus is adductor brevis. And both of these attach pretty much the same spot over on that pubic bone there, and attach to the medial part of the femur, and they are adductors. They adduct. Adductor magnus is different because adductor magnus attaches to the ischial tuberosity, not the pubic bone. So it's the only one of your adductors that attaches to the ischial tuberosity instead of the pubis. So that's one way you can always identify this one. So I can show that to you. There it is. Adductor longus here on the pubic bone down to the anterior femur. Here's anterior femur as well. You can see this is a magnus for big. And it's on the ischial tuberosity, not on the pubic bone like these other adductors were. So that's the way you can definitely tell the difference here. That's a really important detail, is that this adductor magnus attaches to ischial tuberosity, not the pubic bone. So pectineus is the most lateral part of the pubic bone, then adductor longus and brevis, and then finally gracilis attaches to the most medial part of the pubic bone, and that's this muscle here that I pulled off a second ago. Right here. So this is gracilis, and it comes all the way down and attaches to the medial part of your tibia here. So again, it's going to adduct. So you have 5 different adductors. What's that? Gracilis is that thin muscle going all the way down the inside of your thigh there. So when someone says they pull their groin, what they mean is they pull one or more of their adductor muscles. So if you hear that, that's what they're referring to. All right. Now we've got to move the leg, and here we mean the lower leg, of course. So let me get your slides changed. That'll work for now. All right, first is biceps femoris here. So biceps femoris is right here. Let me get you a better picture of the hamstrings. It's one of your hamstring muscles, and it's going to be your lateral hamstring muscle. So you notice if you feel the back of your knee, there's a tendon. You feel a big tendon on each side, and so that lateral tendon behind the knee sort of forms like a bowl or a pit in your knee back there, and so that rim is formed by those 2 tendons, and one of those tendons, the lateral tendon, is the biceps femoris tendon. So that's it. That's just that hamstring muscle on the lateral part of the hamstring. This guy right here. That's biceps femoris, lateral side, the lateral hamstring muscle. Okay. Now the medial hamstrings is actually formed by two different muscles, but luckily they're same name similar. These are semis, semitendinosus and semimembranosus. Semitendinosus is more superficial. Semimembranosus is underneath, is deeper. But they form, their tendons come together to form that more medial tendon. And all three of these muscles actually originate on the ischial tuberosity. All of your hamstrings originate on the ischial tuberosity. So it allows you to, it actually does two things. It allows you to actually extend the hip. So these also extend the hip, but they also flex the knee. These are big knee flexors. But they also are very active in extending the hip as well. So several things it does there. It works two joints really. These muscles really could have been put in moving the thigh as well. But nobody else flexes the knee like these guys, so that's going to be their important role. Sartorius is this big long muscle that I pulled off earlier. Switch this around. Let's see. Where am I from? Am I getting something mixed up? Oh, there we go. Oh, there we go. So this originates from your ASIS up here, and it sort of crosses to the medial part of your knee here, and attaches all the way. Actually, let me turn this around so you can see it. So it attaches the ASIS up here, it comes all the way around to the medial part of your knee. And this is called, and often I call this the cross the leg muscle, because this is what it does. It allows not this kind of cross the leg, but this kind of cross the leg, where you just put your ankle on your other thigh. So it has several different actions. That's kind of a complex action here. So everything it requires for me to do that. So it flexes the hip, and it flexes the knee. It laterally rotates. That's it. All right. Yeah, flexes the hip and the knee and laterally rotates. Oh, and it abducts the hip. So it does all those things. So laterally flexes, abducts. Flexes. Okay, let me try that again. Flexes the hip, abducts the hip, and laterally rotates the hip, and it also flexes the knee. So this one is another one. It could have been put in either the thigh, moving the thigh, or moving the legs. It does both. It actually moves the thigh more actions there. So this is one of those you really need to know which joint you're talking about with this one. So so this one, if I asked you what actions of sartorius are, and you just put flexes and laterally rotates and abducts, I'm going to be going, what? Which joints? Because you have this muscle has two joints that it crosses. And so, yeah, really important to note which joint you're talking about flexing or extending when we talk about actions of muscles. All right, rectus femoris. So remember, rectus means the center, and of course femoris refers to the thigh. So here is this muscle. Now when we look at the thigh, the quadriceps muscles group that this is called. So we had the adductors earlier, moving most of the hip. We have the hamstrings back here that flexes the knee and extends the hip. Now we have the quadriceps muscles that are going to extend the knee and actually flex the hip some as well. So only one of these actually does that. Rectus femoris does that. The others don't cross the hip. So Rectus femoris actually starts on the AIIS. That's the anterior inferior iliac spine, which was not on your list, but that's where it does attach. Just underneath the ASIS, but it's on your ilium. And so it does cross the hip. It does allow some help in flexion of the hip. And but the big key to remembering this quadricep group is understanding. Okay, first of all, rectus femoris. Rectus means center, so that's going to be the center right there. And everything else needs to be based off of the center. So when you say because the other muscles in here kind of tell you, give medial and lateral. So well, there's a center. Now that you have the other vastus muscles. So vastus medialis is medial to rectus femoris. So this is going to be this muscle here. This one is more distal, so it kind of pops out a little bit over here on the distal, just next to the knee. So that's vastus medialis over here. This is vastus lateralis over here. And again, all these are going to be extenders of the knee. These do not attach to the pelvis, though. These vastus muscles attach to the proximal femur, not to the pelvis. So these are only knee muscles. All of these are going to come together to form the patellar tendon. So these go from attached to the proximal femur. These vastus muscles attach to the proximal femur, and again, along with rectus femoris, form that patellar tendon and attach to the tibial tuberosity. Now, so we got vastus medialis on the medial side of rectus femoris, vastus lateralis on the lateral side of rectus femoris. And if we remove, gotta get sartorius out of the way again, but if we remove our rectus femoris, then underneath that we have the vastus intermedialis, or vastus intermedius, excuse me, vastus intermedius. And again, does not cross to the pelvis, stops at the proximal femur here, and again, forms part of the patellar tendon and extends the knee. All right, last group. You probably want more. All right, so we're down to our lower leg now. Just get these out of the way. Need those anymore. Looking at the lower leg, and I've just gotten way off of my slides here, but there we go. That's what I'm looking for. So here again, rectus femoris from that center of the quadriceps muscles, and then you have the vastus lateralis, goes lateral side, and vastus medialis here, and then vastus intermedius will be underneath rectus femoris there. Right. So we got to move the foot. So what I usually do is the best place to start. This is going to be a little tricky muscles, but they're not terrible. I think these are a little better, in some ways they're a little better than the forearm. The tough part is these at the very end, so you're usually tired by the time you get to these. So start with. What I usually do is start with your shin bone, your tibia, because you can feel that nice and prominently up here. So you feel that tibia, and then you go anterior, or actually you kind of go anterior and lateral to that tibia. And so you're coming right here, and this is your tibialis anterior. So that tibialis anterior is going to be right next to the tibia, and it's the tibialis part, and it's anterior, so it's more on the anterior part of your lower leg here. So that's tibialis anterior. It originates up on the tibia there. It's tibialis again, and it actually attaches down on the medial part of your foot here, kind of right on the arch, right on kind of on the navicular and that intermediate or that medial cuboid. God, I keep saying the wrong word. Medial cuneiform. And actually, it might go to that first metatarsal too. I'm not sure exactly its attachment, but it's basically right there in the arch. If you know on that medial arch, that's fine too. So its job is to dorsiflex. So when it contracts, it's going to dorsiflex. It's that large tendon, by the way, that pops out. If you dorsiflex your foot a little bit, there's a big tendon that pops out right on the front of your ankle there, and that is the tibialis anterior tendon. And so it's the most superficial muscle right next to your tibia there, your shin bone. And so it's gonna dorsiflex your ankle, and it's also going to help do a little bit of inversion, just a little bit. Fibularis tertius. These fibularis muscles are on the lateral side. There's a whole group of fibularis muscles. Sometimes you'll see these called peroneal muscles. So you'll hear peroneus tertius and peroneus longus and peroneus brevis versus fibularis. And those are the older terms, or at least, I don't know if they're older, but they're just not used quite as much as fibularis anymore. And remember, fibula is over on the lateral side of your lower leg, so that can be helpful. So these fibularis muscles are over here. Now, one of the things you have to notice when you're looking at the leg here, or at the ankle here, is that it makes a big difference whether a tendon goes behind or in front of your malleoli. Let me see. There's tibialis anterior by itself. So when a tendon goes in front of this muscle, the tendon down here is going anterior to that medial malleolus. So that means it's actually going to dorsiflex. If a tendon goes behind, posterior to that that malleolus, whether it be lateral or medial, doesn't much matter, it's going to plantarflex. It kind of forms a fulcrum point right there, or almost like a pulley kind of thing when it goes behind that malleolus there. And in this case, the lateral malleolus. Remember, fibularis muscles are on the lateral side. So fibularis tertius comes down here and actually attaches to the toe there, but mostly it's going to dorsiflex here, and a little bit of eversion. Because again, it's on the lateral side, it's going to pull that lateral side up to evert. So tibialis anterior, dorsiflexion, inversion, fibularis tertius, dorsiflexion, eversion. All right, extensor digitorum longus, just kind of very similar to the arm here, is that extensor digitorum longus is going to be on the dorsal part of the foot because it's going to extend. The tendon's going to come anterior to your malleolus, and so it's going to be just this muscle up in here. Actually, it's this guy right here. So just lateral to your tibialis anterior. This model's not super clear about. It's hard to kind of identify each muscle in this model. Let's see. Extensor hallucis longus is the muscle that specifically goes down to the big toe. It's a little deeper, kind of underneath that. It's kind of underneath that extensor digitorum longus. But extensor digitorum longus goes to toes 2 through 5, whereas the hallux is actually your big toe. So extensor hallucis longus is going to extend the big toe. It's going to dorsiflex that big toe. All right. So we kind of have our anterior muscles done. Let's go to the posterior side. And the easiest muscle to identify is the gastrocnemius muscle. And it is the only one of these muscles that also crosses the knee. So this has a little bit of flexion of the knee. But its main thing is that this is going to form the Achilles tendon along with another muscle. The soleus forms the Achilles tendon and attaches to the calcaneus in your heel bone. So this allows you to plantar flex. And this is strong muscle. You have really strong muscles here, and you have a lot of leverage right here. It's a very different sort of lever system than most of the rest of your body, and I'll cover that in lecture, not worry about it right now. But what you'll notice is that you're pulling back here, the weight of your body is more forward, but then the fulcrum points here. It works like a wheelbarrow to lift you up. And you can think about how much leverage you have with a wheelbarrow. You just have a lot of ability to lift way more than you could ever lift, without that leverage. But the gastrocnemius is kind of these two heads here. So a lot of times on bicyclists, other people that just have really defined calves, you can see those two sort of heads right there, and that's that gastrocnemius. The soleus is just underneath the gastrocnemius, it's just deep to that gastrocnemius. It does not cross the knee. And that's why a lot of times you see people when they stretch their calf muscle, because calf really refers to both gastrocnemius and soleus, and as well as really any of these plantar flexors. But anyway, when you see runners and other people stretching their calf muscles, what you should see is that they will bend their knee, and then they'll usually leaning over or something. You can't see my legs very well, but they'll sort of put their heel to the ground, and that back leg here, and they should keep their knee locked for a little bit and stretch, and that'll stretch gastrocnemius, because if you lock that knee, that's going to tighten gastrocnemius. And then unlock the knee, and that'll relax gastrocnemius. You can't get a gastrocnemius stretch with your knee locked, but you can get a soleus stretch. So you can actually target each of those muscles individually that way. Anyway, so soleus again touches just to the tibia there, and then comes down and becomes part of the Achilles tendon, which attaches to the calcaneus here. Plantaris is just a muscle here. Let's see if I can picture that one. Yeah, there it is. Just a really skinny muscle attaching back here to the back of the femur here, and really long, and it comes and touches the heel as well, kind of right there with the Achilles tendon. It's the plantaris muscle. You know what? Let's just take this one out. Don't worry about plantaris. It's a tiny little, not worth worrying about muscle there. All right, flexor digitorum longus. We had extensor digitorum longus, and now we need to have flexor digitorum longus. Here it is right there. So one of the things you're going to notice is that it becomes behind that medial malleolus, and sends tendons to all your different toes, allows you to flex your toes, again, toes 2 through 5. You also have a flexor hallucis longus, and for some reason it didn't make the list. I'm not sure how that happened, but whatever. Don't worry about flexor hallucis longus, but it's obvious. It goes to your big toe. And whereas flexor digitorum longus goes through toes 2 through 5. This is why you can really, because we have separate muscles going into the big toe, this is why you can really isolate the big toe a lot more effectively than you can toes through 2 through 5. Tibialis posterior, we're back around to our tibia now. So come back to our tibia, and it's the muscle that's just posterior, on the posterior, more medial side of the tibia. And so and again, this tendon goes behind the medial malleolus, so it is actually, and then attaches down here to that arch again. So it is actually going to plantar flex and help, but also invert. So it helps support the medial arch as well. Also, also called the medial longitudinal arch. Same thing. And And finally, we have fibularis longus. This is the craziest muscle of our whole lower leg here. So fibularis means it's going to be a lateral muscle. This one, though, fibularis tertius is the only fibularis muscle that actually goes anterior to the lateral malleolus. The other two fibularis muscles actually come behind that lateral malleolus. So these are two tendons for your fibularis muscles. And the longus muscle, you have a longus and brevis here. So fibularis brevis actually just comes and attaches down here to the lateral part of the foot. But fibularis longus, the one that's on your list, makes a stirrup. So it comes along and goes behind that lateral malleolus, and then goes all the way under your foot and attaches to that medial arch again. So it attaches to the same basic place where tibialis anterior and tibialis posterior attach. But it's coming from the other direction. So this is a really strong everter. So it's going to really twist that foot into eversion as well as doing some plantar flexion. All right. So that's it. Just like that. No problem. So it's all about getting the system down, understanding where these things are attaching. That is how you're going to get these different leg muscles here, these lower leg muscles, or any of these muscles really. So, yeah. Great. Hope this was helpful. Watch this as many times as you want, and I will see you guys in